this isn't like a crack. Does she know where we are?
Mm-hmm.
Yeah.
Yep. Okay, sure. So thank you all very much for coming. So my name is April Pickering, and I'm the Director of Population Health and Primary Care Services here at Community Physician Group and Community Medical Center. And really, we are excited to have you here. We've partnered with the University of Montana to do an adolescent health, patient, and family advisory council. So in some of our other clinics in family medicine and internal medicine, we've started some of these patient and family advisory councils because there's really been a shift in healthcare for population health to be more patient-centered and to work with patients and their families to help us determine what we can do better in terms of care delivery, efficiency, process improvement, and to provide better quality care to our patients. So that being said, we really want to start working more with patients and their families to get their opinions on a whole host of things. Our partnership with the university really has focused around immunizations and the use of immunizations and education around that. But really, we would love to use this meeting and maybe meetings in the future to look at different things and to get your opinions on your thoughts and experiences on what it's like when you go to see your healthcare provider or physician. And so we really, really appreciate you being willing to come out tonight to help us work together to see how we can provide better care for you. Do you have anything else? We'll let the rest of this team introduce themselves.
Yeah. No. Go Grizz. That's all I was going to say.
Well, I mean, I'll go next because I'm Gretchen, and I've been talking to half of you. Communicating with half of you. Come on in.
Oh, yeah, come in.
Hi,
Good, how are you?
Oh, I will just hang out for right now. Since I came in.
Hi, Terry. I'm
Hi.
Gretchen.
Nice to meet you, Gretchen.
Thank you.
Sorry.
So I'm a graduate student in community and public health at U of M, and I got brought on board to help with organizing and recruiting and talking to all of you. So here I am. That's me. That's what I'm doing here. I'm also really excited you all came.
Well, I'm Beth, and I too am a graduate student at the university working in community and public health, and I have been working with Sophia specifically on HPV vaccines and learning a lot about that, so that's one of the topics we'll talk about today, and I am very interested to hear what you adults, parents have to say, so looking forward to it. Thanks for coming.
And I'm Sophia Newcomer. Sorry, I should have introduced myself. And I'm a faculty member at the university in the School of Public and Community Health Sciences. And like April mentioned, a lot of my research focuses on immunizations. But more broadly, I do work in child and adolescent health. So, we're just really excited. In research, too, just like April was talking about in clinical practice, there's a really big movement toward getting input from patients who, who would benefit from research in these areas. So, we're just really grateful that you guys showed up and are willing to chat with us. Did we want to go around and continue intros?
Yeah, I think that would be
Great.
Maybe tell us your favorite color.
I'm Carrie Sullivan Lechner. My favorite color is green.
Oh, wow.
Wow, shocking. No. I'm Carlin
And my favorite color is purple.
Would you guys say what school she goes to? I'm just curious.
Oh, I go to Loyola.
Oh, nice.
My name is Terry, and I will say that I like turquoise probably the most.
I'm Addie, and my favorite color is blue, and I go to Lolo Middle School.
I'm Sydney, and my favorite color is yellow, and I go to Sentinel.
I'm Marge Buck, and my favorite color is blue.
I'm Logan, my favorite color is blue, and I go to Chase Porter.
All right. Well, before we get started, we wanted to just establish some ground rules because it's good practice to establish ground rules when you're in a group. And so I've got a couple here that I wanted to propose, and then if anybody else has any ideas that they want to add to that, we can do that, okay? The first one is confidentiality. So anything that you guys say here, we don't want to go and talk about it with other folks. So this should be this is a private conversation. We are recording the conversation. I know that's like, whoa, what? It's so we don't have to take notes. And when we transcribe it, we're going to get rid of all of your names. So there won't be anything that connects any of you to anything you say at all. If anybody has any more questions about that, please talk to Sophia or myself, because we'll be the ones doing the writing down of what's recorded. Second ground rule, respect. It's a good one, right? Just in general. This other one, step up, step back. I don't know if any of you younger folks have heard that one before, but essentially, we really want to hear everybody's opinion. So if you find that you're the one that talks all the time, maybe stepping back to let other people say something, or if you're the one that doesn't talk very much, maybe stepping up and letting us know your opinion, because we really do want to hear it. Try to have fun. Try. That's all we can ask. And then be honest, please. We want to know what your actual opinion is. We're not here to try to sell you on anything. We just want to know what you think. So, does anybody have anything they want to add to that? Okay. All right.
I like to have fun with.
Yeah.
It's always important.
I think so. Especially at meetings. Sometimes meetings are not as exciting as you'd like them to be.
So I think in a few minutes we're gonna break up into groups. So Beth and I are gonna meet with the parents, the guardians, and then April and Gretchen are gonna meet with the adolescents. And we have like a variety of topics to talk about, including immunizations, including what you think about the clinics and just the patient-provider interaction, access to medical records, a bunch of things. But I think before we split up, does anyone have anything they just want to, lay out there or start with by letting us know about adolescent health, or any questions or anything before we split up?
I'd be curious to hear why people said yes.
Oh yeah.
It might be interesting because we love that you did.
Yeah.
And it's okay if the answer is the incentive, which we will be giving you.
Yes, we will be giving you that.
Yeah, that's
Don't
actually
live without
good to know.
Look at your face. You want to answer first? No. Okay, I'll go first. I'm the director of quality improvement at Partnership Health Center, and so I like to be. And I feel like you just have a Blue Cross Blue Shield meeting up in Holland.
I was.
Okay. I was like, I recognize you from somewhere. I'm trying to figure out. Anyway, so I'm always about improving healthcare in whatever facet I can possibly do that. I've worked as a consultant role. And so when we were in for Logan's well child visit and saw the flyer, so that's where we're here. And I told her it would be, she kind of see what I get to do at work. That was not so. Yes. So, anyways, I'm always, and I too believe in getting the patient perspective. So I'm glad that you guys are doing this. This is awesome.
Thank you.
I can speak from the girls. Both of these are my daughters. I work here at the Cancer Center. I'm a nurse here, and so I'm what's called a nurse navigator, and I get all the new diagnoses and talk with the patients. So I also, for health fairs and things like that, promote different services. Definitely, I've done the lung cancer screening and smoking cessation for the